Here at 9:15 in Health News, May is National Older Americans Month, and we know there's some new research that is showing that it's challenging everything we think we know about aging well. To break down this new research, our best-selling author, gerontologist Dr. Carrie Burnite, and Dr. Sanjay Shetty, president of CenterWell. Thanks, you two, for joining us here this morning.
Thank you so much for having us.
So let's talk about the end of retirement, right? We hear the golden years, and that marks the end of a long career. But what is this new research telling us about whether that image holds up?
The new research is really important, especially given the fact that every day 10,000 more of us are turning 65. And what we've learned is that the traditional assumption that it's just all about physical health doesn't go nearly far enough. And this new research on fulfillment addresses the fact that there are overlapping challenges and opportunities as we live these longer lives. And the overly simplistic, it's just all physical, no longer holds.
So the fulfillment index, right, is what the term that you've come up with. So what does it measure? How does it do that? And why is it different from just the physical definition of aging well?
Yes, well, CenterWell exists in order to help our older adults live healthier, happier lives. And that's why we did the research, in order to understand what really matters to older adults, so that we can help them not just live longer, but live longer well. And so that's where this research came from. And what it showed us was that living well actually means a lot more than physical health. There are so many other factors that matter. Things like your purpose, like your connection, like your security. These are all elements that we have to focus on. And so for the medical community, what we're going to try to do is to look beyond just the clinical outcomes, to add something like a whole person index, like the fulfillment index, so that we can better understand how to help patients age well.
So then the finding I see, it shows that nearly half of Americans over 62 report low fulfillment. Does that surprise you?
I think what we are seeing is that in order for us to really address whole person health, we have to think about and ask about all the other items that actually may be impacting their daily lives. And so we believe that this is a metric that we can continue to improve, not just through organizations like CenterWell, which are focused on the health and well-being of older adults, but every stakeholder in the community that can work together to address things like purpose and connection and connectivity.
So is there one factor that really has that bigger impact then when it comes to purpose and connection?
Yeah, so definitely, I think what you are going to see in the research is that the ways that people approach their lives, like through purpose, like through a sense of mission, are some of the things that matter the most. And all of these other elements are also incredibly important, but really support that. So that financial security, having mental health, physical health, all support that overlying sense of why you feel well and why you feel like your aging is fulfilled.
Dr. Burnite, you work directly with older adults. What are they telling you that they feel they're missing from their lives?
A lot of older adults convey that they miss the social connection that they once had, maybe in a workplace or when they were raising their children. And so what we've learned is that we not only need to pursue well-being from a narrow lens, but really broaden that lens so that we are bolstering these factors that support higher level contentment.
So what can families do right now on a practical level to help an older adult or loved one get those scores a little bit higher?
What I would do is I would go to centerwell.com/CWFI to read all about fulfillment, to give you the tools you need as an older adult and working with older adults.
All right. And then the message this morning in our takeaway, if we have a viewer who finds that they're experiencing it or knows someone that is seeing that lower fulfillment, what do you tell them today? What's the message?
It's a message of hope. The message is, with these longer lives and with the Central Well Fulfillment Index addressing our whole person, that there is hope that if you're not feeling fulfilled now, that you can with attention to these measures.
All right, Dr. Sanjay Shetty, anything else you want to add?
No, we're just so excited to be able to share this work and to start to pivot the conversation about what it means to age well.
All right, I love it because, we do that every day. We age a little bit every day. We're going to get there before we know it. Make it last, make it count. Dr. Carrie Burnite, Dr. Sanjay Shetty, we thank you for your time this morning.
Well, thank you for having us.
Absolutely.